Hi people, I am here to explain about migraine type of headache today. We have to discuss about the definition, signs and symptoms, types, etiology, pathophysiology, diagnosis, treatment and prevention. Definition: migraine headache is a neurological disease that causes severe hurting pain, usually on one side of the head. It occurs with nausea, vomiting, and sensitivity to light and sound. Migraine affects children, teenagers, as well as adults. Signs and symptoms: it progresses through 4 stages. They are prodrome, aura, attack, postdrome. Firstly, prodrome. 1 or 2 days before a migraine. These changes were of an upcoming migraine includes constipation, mood changes from depression to euphoria, food cravings, neck stiffness, increased urination, fluid retention, frequent yawning. Secondly, aura. It occurs before or during migraines. These are reversible, visual, and can last up to 60 minutes. Includes visual phenomena such as seeing various shapes, bright spots, or flashes of light. Vision loss, pins and needle sensation in an arm or leg, weakness or numbness in the face or one side of the body, difficulty speaking. Thirdly, attack. This is during migraines. Includes pain usually on one side of the head but often on both sides, pain that hurt, sensitivity to light, sound and sometimes smell and touch, nausea and vomiting. Finally, postdrome. After a migraine attack, feels drained, confused and washed out for up to a day. Types of migraine. There are several kinds of migraine. The most common are migraine with aura, also known as classic migraine, and migraine without aura, also known as common migraine. Other types include: first one, menstrual migraine. This is when the headache is linked to a woman's period. Silent migraine. This kind is also known as aspalgic migraine, here having an aura symptoms without a headache. Vestibular migraine, having a balance problems, vertigo, nausea and vomiting with or without a headache. This kind usually happens in people who have a history of motion sickness. Abdominal migraines. It causes stomach pain, nausea and vomiting. It often happens in children and may change into classic migraine headaches over time. Hemiplegic migraine. Short period of paralysis or weakness on one side of the body. Also feels numbness, dizziness or vision changes. Ophthalmic migraine, also known as ocular or retinal migraine. It causes short-lived, partial or total loss of vision in one eye, along with a dull ache behind the eye. It may spread to the rest of the head. Migraine with brainstem aura. Dizziness, confusion or loss of balance can happen before the headache. The pain may affect the back of the head. These symptoms usually start suddenly and can come along with trouble speaking, ringing in ears and vomiting. This type of migraine is strongly linked to hormone changes and mainly affects young adult women. Status: migrainosus. This severe type of migraine can last more than 72 hours. The pain and nausea are so intense. Ophthalmoplegic migraine. This causes pain around eye including paralysis of muscles around it. Also cause aneurysm, droopy eyelid, double vision. Etiology: genetics, environmental factors, hormonal changes in women, alcohol, too much caffeine, stress, bright or flashlight, sleep changes, physical factors, weather changes, medication, skipping meals. Diagnosis: blood test to find out the blood vessel problems or infections or toxins. CT scan to find out the tumors, infections, brain damage, bleeding in brain. MRI scan, imaging of brain and blood vessels. Spinal tap or lumbar puncture to find out the infections or bleeding in brain. Treatment: migraines can't cure. Just to relieve or prevent migraines, some drugs are recommended. They are pain relieving medications and preventive medication. Pain relieving medications. They include pain relievers, examples aspirin and NSAIDs such as ibuprofen. Triptans: sumatriptan, rizatriptan, almotriptan work by promoting constriction of blood vessels and blocking pain pathways in the brain. Ergots. These are less effective than triptans, but most effective in those who pain lasts for more than 48 hours. Examples: dihydroergotamine, anti-nausea medication, chlorpromazine, metoclopramide. Opioid medications also recommended if patient is not taking any triptans or ergots. In some conditions, glucocorticoids also recommended. Preventive medication to prevent or reduce frequency of migraines. These are recommended. Cardiovascular drugs: beta blockers, propranolol, timolol. Calcium channel blockers, verapamil. Angiotensin converting enzyme inhibitor, lisinopril. Antidepressants: tricyclic antidepressants like amitriptyline and also serotonin and norepinephrine reuptake inhibitors like venlafaxine are also helpful, and Botox injections are recommended. Prevention: manage stress by meditation, yoga and mindful breathing. Eat on a regular schedule. Drink lots of fluid. Get plenty of rest. Get regular moderate exercise. Dim the light. Hydrate.